PGT-A, which stands for Preimplantation Genetic Testing for Aneuploidy, is a test that can be done on early-stage embryos to check for any kind of chromosome abnormalities. It's a test that is used by fertility doctors, as we know that any embryos with chromosome abnormalities are very unlikely to lead to an ongoing pregnancy. So it's widely used as an embryo selection tool alongside your IVF treatment to increase chances for a successful pregnancy. Anybody that is having IVF treatment may benefit from considering including PGT-A alongside their treatment. However, there are specific groups or individuals that may benefit more from including PGT-A. These would include couples where the female partner is a little older, typically over the age of 35, as we know that the risk of chromosome abnormalities does start to increase as females age. Other cases where we may want to consider including PGT-A would be where an individual or couple have experienced recurrent miscarriages or failed implantation following embryo transfer. You will go through your IVF treatment with your fertility clinic. Embryos are created in the laboratory, and at around day 5 or 6 of embryo development, the embryologist removes a few cells from each embryo. Typically, they take between 5 and 8 cells, and that biopsy sample is sent to the genetic testing lab while your embryo remains frozen safely at the clinic. The genetic testing lab will then process that sample using next-generation sequencing to produce results regarding aneuploidy in the embryos. Once the results are available, that will be sent back to your fertility doctor so that they can use that information to select the best embryo for transfer. This whole process typically takes about 2 weeks. The benefits of PGT-A include an increased confidence in transferring a single embryo per transfer, because we know that that embryo has the correct amount of chromosome material. Overall, it can also reduce the time between IVF cycles if multiple cycles are needed. One of the largest benefits of PGT-A is that it can reduce the risk of miscarriage. Because we are selecting embryos that we know have the correct amount of chromosomes, we can increase the success rate per embryo transfer.